is Sini, and I am the practice manager for Dr. Michael Polcino, a board-certified OBGYN. Today we're going to speak about identical hormones, but first I'd like to give you a little introduction. The average woman starts to experience menopausal symptoms at the early age of 41, and they can continue throughout her 60s. That means we could spend almost half of our life in menopause. To answer some of our questions in regard to this time of a woman's life, let me introduce Dr. Polcino to you. Good morning, Dr. Polcino.
Good morning, Chris. Thank you.
When a woman is told she is perimenopausal or menopausal, just what does that mean?
Well, by definition, menopause means that you have not had a period for about a year. And so the average age of menopause, as you said, is 51. But normal, a period can stop at someone at 40 and also at 55, and that's all normal. Perimenopause is when the changes of hormone loss has already begun. And usually we say that can start 10 years before you have the menopause. So that means you can have hormonal changes starting at 35 and have many years of those symptoms.
What are the symptoms a woman can experience?
I knew you were going to ask me. And we all know about hot flushes and trouble sleeping, but there's so many, so I said, let me get my list. Anxiety, insomnia, irritability, depression, painful intercourse, vaginal itching, bloating, aching ankles, sore breasts, snoring, weight gain, panic attack, and these are just some of them. Remember that estrogen affects over 400 organs in the body, and so there's lots of symptoms you can have.
Well, talking about all these symptoms, are there any treatments out there for the women?
Sure, we really do. We have two things we like to do. We like to modify lifestyle. We know that exercise and diet and relaxation techniques can really help with some of these symptoms. And also we can replace the hormones that's really the cause of these symptoms. Because the estrogen, progesterone, and testosterone are not being made anymore, women experience these bad symptoms.
I've read a little bit about the Women's Health Initiative. Can you explain that to us?
Sure. In 2002, there was a study of women who had been taking hormone replacement at that time. The hormones that they used were Premarin and Provera. So the Premarin is the estrogen from horses, and the Provera is a synthetic progestin. They studied the risks of heart disease and breast cancer, and they found that there was a slight increase in the study that they had. It changed everything. Everyone became frightened of the hormones, and for many years no one was using hormones. When they reevaluated the numbers, they found that the problems were not as bad as they thought, but they did have some good understandings where the problems came.
Please explain the difference between hormone replacement and the use of bioidentical hormones.
Sure. Remember we said that the Premarin was the estrogens from horses. So now we can make estrogen that's bioidentical, the exact same chemical structure that a woman's body makes. We can do that from progesterone, we can do that from testosterone. And what we do is we start with the hormones from yams and from soybeans, and we're able to modify it so that it's the exact chemical. So now when we give a woman these hormone replacements, we're giving them the same chemical their body has always been used to, knows how to break down, and symptoms really are gone.
Have you had success with your patients on bioidentical hormones?
Yes, we've had many patients that we're able to help and really change their lives, because those 40s, 50s, and 60s and beyond, should be as good and better than those 30s and 40s.
Well, thank you very much, Dr. Polcino.
I hope this short discussion with the doctor increased your awareness and understanding of the use of bioidentical hormones.